Good day, I am Camila Oliveros.
And I am Mark Henry Borlasa from Section 25.
Today, we're going to show two scenarios wherein the specimen is rejected upon receiving. There are many considerations that we should apply when receiving the specimens, and if those criteria are not met, it should be rejected.
And these are the reasons why a specimen is rejected. Discrepancies between the requisition and the specimen labels, no labels or mislabeled specimen, requisition and specimen labels, leaking specimen containers, absent clinical data or history, inappropriately identified specimen.
For the first scenario, I will be the one who will deliver the specimen, and Mr. Bulasa will receive it. The specimen will be used as a lymph node, and the reason for the rejection is discrepancy of information between requisition and specimen label in the container. Good afternoon, sir.
Good afternoon, ma'am.
I am Camila Oliveros from the operating room, and this is a specimen sample from a patient, Juan Jane Cruz. This is a cervical lymph node.
Okay, ma'am, I will just verify the information in the requisition form and in the label before you leave.
Okay, sir, thank you.
The patient's name is Juan Jane de la Cruz, same as in the container. Birth date, January 3, 1956, also the same. OPD number 20345, OPD number 20001, OPD number 20345, OPD number 2001. I'm sorry, ma'am, I cannot accept this specimen because there is a discrepancy in the OPD number between the requisition form and the label in the container.
Really, sir? May I check?
Here,
Okay. OPD number 20345, OPD number 2001, OPD number 20345, OPD number 2001. Sir, can you just consider this since the name and the birthday are the same?
I'm sorry, ma'am, this is part of our protocol. If there is any discrepancy between the requisition form and the container label, the specimen will be automatically rejected.
Okay, sir, I understand. I'll just recheck the information and come back. Thank you.
Thank you, ma'am.
In this scenario, the specimen is rejected because of the OPD number in the requisition form is not matched with what's in the container. The specimen container must bear the same name and accession number as those in the requisition form. Patient identification is one of the most crucial parts of the laboratory testing, and proper identification may lead to misdiagnosis of patients and incorrect treatment.
For the next scenario, I will be the one who will deliver the specimen and Miss Oliveros will receive the specimen. In this scenario, the reason of rejecting the specimen is the wrong specimen container. The specimen will be used is an incisional biopsy of skin. Good morning.
Good morning, sir.
I'm Mark Borlasa from the operating room, and Dr. De La Cruz would like to know if this tissue specimen has a problem or not.
Okay, sir, let me see the requisition form and the specimen.
Here it is.
I'm sorry, sir, but the specimen container you have is not appropriate. I cannot accept the specimen.
But the requisition form and label was all correct. Maybe you can consider that.
I'm sorry, sir, but this is part of our protocol. We should reject specimens that are in the wrong or inappropriate container.
Okay, ma'am, I understand.
Okay, sir, thank you.
In this scenario, the specimen is placed in a purple top tube or EDTA tube, which is used for blood collection, and the reason why the personnel in the histopathology department rejected it because it is in a wrong container. The ideal container for histopathology department is a sterile plastic container. The container used was an EDTA tube, which is already has a component that may contaminate the specimen.
As a medical technologist, we should be very careful on receiving the specimen. We must take a look at the criteria mentioned earlier to ensure the quality of the specimen in the test.
This will ensure that the results came from us are accurate and precise, and won't lead to misdiagnosis and mistreatment of the patient. That would be all. Thank you. Have a nice day.